Welcome to 50 Plus in Montgomery County, a monthly program that is a voice for many, produced by the Commission on Aging, of which I am a community member. This show is insightful for people of all ages, and each episode takes a fresh look at important issues by spotlighting older adults in the community, representatives of services and programs, and activities of interest to older adults. My name is Katie Smith. On this month's show, we're going to talk about elder abuse. Joining me to have this discussion is Mario Wawrzusin. Mario is the Senior Administrator of Assessment of Adult Protective Services and Care Management Services at the Montgomery County Department of Health and Human Services, Aging and Disability Services. Hi, Mario.
Hi, Katie. Good to be here.
Mario, let's just go ahead and kick things off. Tell us a little bit about yourself and your background working with older adults.
Yeah, sure thing. I'm a clinical social worker, and I'm also, as you noted, administrator for our section in adult services that works with adult protective services and general support services. And I've been with the department since, 30 plus years doing various roles, caseworker, doing APS investigation work, guardianship work, supervisory work, and now I have the honor to really be in this particular role and have an opportunity to speak with you and our audience today.
Well, that certainly makes you an expert, and I'm so interested to learning more about this subject from you. As you know, Mario, June is Elder Abuse Awareness Month. The month also includes World Elder Abuse Awareness Day on June 15th. Can you talk about what is elder abuse?
Sure. Elder abuse refers to, in general, any adult or vulnerable adult or elder abuse where there's an intentional or malicious act against an older person who perhaps is having some physical or cognitive challenges, be it a stroke, Alzheimer's disease, and there's poor care being taken care of. There's either physical abuse, could be sexual abuse, and financial exploitation is also an area that we look at where someone's taking someone's money and not using it for that particular individual's care, but rather misusing it. Could be property as well, and even person. Additionally, my team will work with self-neglect issues, meaning someone is no longer really able to do the basics of showering, dressing, meal preparation, paying their bills, keeping a home going. Perhaps they had a stroke, maybe early onset dementia, Alzheimer's disease, cardiovascular disease, things of that nature. So Adult Protective Services will receive a call, typically from a community member or a professional, and they will explain the situation, who their concern is, where this is occurring, and some details about what they've observed. And then we will typically send out a clinical social worker, licensed social worker to investigate that situation, create a safety plan, and really look at means to support that individual in the setting of their choice. It's a client centered approach that we take. I know there's misconceptions about what APS does. One of them might be that they come and they put folks in nursing homes. That's not the case. We're really trying to empower our clients, but keep them safe as well. Sometimes folks are doing the wrong thing by them, and then we'll intervene.
Hmm. Mario, it sounds like you serve different clients. Can you talk a little bit more about risk factors? Like, who is at risk?
Sure. And just to be clear, I know we're talking about elder abuse, but in the state of Maryland, really across the country now, we do serve folks 18 and older that have some type of, we use the term vulnerability, meaning that they do have a physical challenge, perhaps a cognitive, learning, intellectual challenge, and that makes them more at risk. And that's what the statistics bear out. Persons who are older, folks who have some type of disability, folks who are isolated, these are folks that are at risk at a higher rate for being taken advantage of or maltreated. And so those would be some of the risk factors that we're aware of in terms of the population we serve.
Keeping the risk factors in mind, what are some of the common warning signs and different types of elder abuse?
Sure. We sometimes refer to those as the red flags of abuse. Also, the National Center for Elder Abuse discusses some of these warning signs. So if there's unexplained bruises, wounds, blue marks, unusual injuries, those are some of those warning signs. If there's unexplained sexual transmitted disease, poor hygiene, if someone is found to not have their glasses, their hearing aids, their clothing's not being cleaned, those would be something that a community member might notice and would be a reason to give us a call. Undernourishment, dehydration, bed sores, of course, if things are moving in that direction, someone's not getting out of the home. If a neighbor notices that there's new characters coming to that house, a person's not getting out to walk the dog, or they don't see them anymore, those are isolation factors that concern us. If there's supporting conditions, clutter, things of that nature. And on the financial side, if there's unusual bank activity, if mortgages or rents are not being paid, utility are being cut off, there's perhaps transfer of property on a home, on a car, or there's an inability really to bring in caregivers that are needed because someone's taken advantage of the resources that should be used for those types of services. So those are a number of the warning signs that we would pay heed to. And I will mention, so if that does happen, we really encourage community members, professionals, family members to give us a call at 240-777-3000. That's our Maryland Access Point, our Aging and Disabilities Resource Unit for our department within Aging and Disability Services. So they will receive that call. And if they discern that it has an Adult Protective Services issue, move it into our system. And we have experienced, licensed, professional social workers that will screen the call. And so we're going to be looking for the who, what, where your concern might be.
Now, Mario, you mentioned, community members multiple times. So as a community member, if I notice a pattern change in my neighbor, what are like 3 to 4 things that I could do or anyone could do to prevent elder abuse?
Well, I would say as a neighbor or even a family member, it's really important to check in with perhaps you have an older neighbor in your community. If it's the winter and there's snowing, or you're noticing mail's not being collected, or if they're getting a newspaper and that's not being collected, check in, say how you doing, and if you have a friendship with them, regular check-ins makes for an increased safety. Also, just the socialization involved with that is really important. Just on a personal level, I know that once I lost my stepfather and my mom now living alone, it's out of state even. I make that daily phone call just to make sure things are good. How's your day been yesterday? So on and so forth. And it's just an opportunity to check in. And if someone is, if a loved one or a friend is in a care facility, assisted living facility, even a nursing home, having regular visits, either in person would be ideal, but tele or video visits, all of those interactions, I think, really do help, on a preventative side. And we do encourage our community members to, as we've come out of the pandemic, to get re-engaged once again with your faith community, your civic community. We have a Vibrant Villages initiative here in Montgomery County. You have dozens of villages that you can get involved with for socialization, doing different activities, volunteer activities, and then we have a plethora of senior centers with terrific programming from physical exercise, field trips, things of that nature, educational events, and all of these are opportunities to interact in the community, and really it's good for your both your physical and your mental health, and frankly your spiritual health. And it's you're getting out. So, but for those that are staying at home, losing touch with what might be happening in the community, perhaps getting lonely, that's a risk factor right there. That isolation, loneliness. You might get a phone call. You might not know that many of these calls that we all receive these days are scam artists trying to get personal identifying information, access to bank accounts, or various scams, from lottery scams, grandparent scams, where false information is provided. Maybe a friendship over a telephone is trying to be established, but with ill intent.
So we really need to be aware and stay vigilant. And then older adults, it's important to stay active, in community and your friend and family circle, and your other social groups, community organizations that you might be involved in. You talked about scams. You just mentioned that. Can you mention a little bit more about what elder theft is?
Sure, that's really the misuse of a person's income, finances, property, and that can occur in any number of ways. There's a law in Maryland that a financial institution needs to report to Adult Protective Services, law enforcement, or state attorney's office if they note unusual activity or large withdrawals. That's not been the pattern for that older adult. They will make a report to us, and we'll screen that. And it's a way to try to keep assets where they need to be, and that is for taking care of that individual. And there's the federal government has reported that over $200 billion have been stolen from older adults in the past, from 2021 through 2022. It's just at epidemic levels. And I know, just personally, I'm getting texts, I'm getting emails, phone calls. And if you don't know who's sending you that information, don't open it up. Don't answer the phone. Let it go to your voicemail, screen it, because these folks are very good at basically pretending that they're either with the federal government or with your financial institution. You owe back taxes. Your Social Security needs to be updated. What they're trying to really do is, they call it phishing with a PH, for information. They want to find out what your name is. Where do you live? They want to confirm that. Social Security number, bank account numbers, and then they have a way to access your funds. And that's why we're seeing record numbers of fraudulent activity.
Now, Mario, I have a few more questions I would like to ask you. If you'll briefly tell us, though, is there anything else that we should know about Adult Protective Services? And what's the role of the Montgomery County Office of the State's Attorney?
Sure. So I'm glad you asked. So Adult Protective Services is really part of a collaborative group. We call ourselves the Montgomery County Vulnerable Elder Adult Abuse Task Force. And that's comprised of law enforcement, state attorney's office, county attorney's office, fire rescue service, ombudsman program. And we meet regularly, monthly, and more so as needed. We review cases. We'll talk about trends. Occasionally, we'll work on legislation together, and really trying to raise awareness in the community about things like these financial scams, for instance, or who you would call if a neighbor's not coming out anymore and you have some concern because mail and newspapers and lawn hasn't been cut, things of that nature. So that there's someone there that could check in to make sure that individual is okay. So collaboration is a big piece of what we do. And the state attorney's office, of course, their role is to, if there's criminal intent noted by, or at least alleged treater, possible criminal intent, they will actually prosecute as needed. That's not the first thing we're going to do. We're going to try to make sure someone's safe. We're going to collaborate. We're going to do an investigation together, and really try to empower that individual, make sure that there's a safety plan in place. But there are times when law enforcement needs to go to court, and state attorney's office is going to be the lead on that.
Earlier, you mentioned if you see something, say something, and to dial 240-777-3000. But is there another hotline number that folks can use?
There certainly is. There's a state hotline that actually does, we do feed into that on all of our calls. That's the 1-800-91-PREVENT, PREVENT. You could dial that direct, and then you just have to file a couple of short directions. So you get to Montgomery County Adult Protective Services, and our screening unit will work with you.
And it's my understanding that you're having an event on June 11th. Can you tell us a little bit more about that?
Thank you. So, yes. So this is our 14th annual World Elder Abuse Awareness event, and I've been fortunate to be at all of them. And I co-chair with Dr. Kimberly Johnson, who's the director of the Area Agency on Aging. And so on Tuesday, June the 11th, we're going to have an in-person event at the Holiday Park Senior Center, which is in Silver Spring. It's the largest senior center in the county. But we're also going to have viewing parties at a number of the other senior centers throughout the county, White Oak, Schweinhout, Damascus, and we're also going to be on Zoom. So for the main program from 10 a.m. to 11:30, John McCarthy, actually, who is our state attorney, is our keynote, but we have some really cool stuff happening. We invited our older adults in the community at the various senior centers to present a skit on either a scam or a situation where there's a neglect or self-neglect situation that you'd like to explore. And they did, and they submitted a number of wonderful videos, about 3 minutes or so. So we're going to show some of those and have that available, have some discussion on that. And I believe we have some family testimony on a case that was worked on by the state attorney's office and a panel. And then we're going to finish it off with some yoga work just to kind of calm down, get back to that center place. That's Tuesday, June the 11th. There's an opportunity to sign up. It's on Eventbrite, and that's at weadd2024mc.eventbrite.com. So if you just go to World Elder Abuse Awareness Day, Montgomery County, Maryland, it should pop up under eventbrite.com. Or you can call us at 240-777-1531 for additional information, or you could call Holiday Park Senior Center, which would be a great idea, because if you're going in person, we do have box lunch opportunities available. And so I would definitely call them if you want a lunch at 240-777-4999 during regular business hours.
Well, Mario, that sounds like it's going to be a great event, very informative and interactive. In about 20 seconds, can you tell us how we can stay in touch with you? Is there an appropriate email address?
Well, we always prefer the direct phone call. So at the 240-777-3000 line. But we also receive emails at ADS for Aging Disability Services, ADS@MontgomeryCountyMD.gov.
Mario, thanks so much for this conversation.
Thank you, Katie. Thanks for having me. I appreciate that.
Joining me is Dr. Kimberly Johnson. Dr. Johnson is the director of the Area Agency on Aging at the Montgomery County Department of Health and Human Services. Hi, Dr. Johnson.
Good afternoon. Thank you for having me.
I'm so glad to talk to you. Dr. Johnson, you're the newly appointed director of the Area Agency on Aging, or the AAA, in Montgomery County, the Department of Health and Human Services. So congratulations to
Thank
you.
you.
Before we talk about your new role, tell us a little bit about yourself and your background working with older adults.
Sure, I would love to. So let me first say that I am a native Baltimorean. So I hail from Baltimore City. I have a background in psychology. I'm a licensed clinical social worker, and I've been in public service for the past 24 years. I started my career early in the field of child welfare, working with children who were in a foster care system and kinship care system. So oftentimes my clientele was grandmothers, grandparents, older adults caring for their grandchildren. And that's when I really, develop a passion to work with older adults. I was also raised by my grandmother. So I love working with older adults. And I found that in that work, they needed so many services. So in addition to connecting children with services, I was also connecting the older adults, the caregivers, to services. And I also grew up passion for caregiving at that time, because I knew if it wasn't for these grandmothers' caregiving roles, then, you know, these children would really be lost in the system. And so I started Montgomery County 2016 as a home care supervisor, providing clinical oversight to clients who needed assistance with daily living through community service aids. Then I moved into my position as administrator for adult assistant administrator for adult protective services and care management programs. And most recently, like you stated, selected to be the director for the Area Agency on Aging, which I absolutely love. It allows me to use my macro background of social work. I love community, working in the community, engaging with community members, engaging with clients. So this is truly a good fit for me, and I'm just so happy to be serving in this capacity.
Now, can you share with us, Dr. Johnson, a little bit more about the agency and your programs or initiatives?
Yes. So the AAA administers the title programs through the Older American Act of 1965. So that act was designed to help older adults to age in place if it is their choice. And that's so very important. So programs and services that we have to do that are around health and promotion, disease prevention. We have a senior care program that provides supportive services to seniors, such as medication reimbursement, funding to attend adult medical daycare, dural medical equipment, so forth and so on. So those are just some of the services that are available to seniors to help them live in the community, in their homes where they've been all their lives. And, you know, that is our goal.
Now, Dr. Johnson, this is not news to you, but June is Elder Abuse Awareness Month, and our first guest, Mario Wawrzusin, he talked with us about the basics of abuse and prevention. He also mentioned his collaboration in terms of the work with you. Now, chances are many of us know someone, who's a victim, or maybe could be more susceptible to that. Can you tell us what are some of the signs that someone could look out for?
Okay, so just to also add to my background, I am a adjunct professor at Morgan State University School of Social Work. So I teach around abuse, neglect, exploitation from the children spectrum, but it's across the lifespan. So what I see in the area of child welfare, I see it in the older adult population. And so I'm very aware of what that looks like. And I really believe in prevention. And so intervention is necessary, but how do we prevent, abuse, neglect, self-neglect, financial exploitation from even happening? That they don't need to come to our doors for that type of intervention. The supportive services to help them stay in place, live in their homes and age in place. That's what I would like to see more of. And so I believe in prevention. And I think the more that we do up front in terms of awareness and outreach, I think that will help, see abuse and neglect cases be reduced. And so we got to be aware. We got to be informed. We can't, turn our heads or look the other way. We have to engage, older adults. We have to ask questions. And so I think if we take on that approach, I think that we can, do a better job with reducing the risk of abuse, neglect, and financial exploitation. And I think social isolation is a key indicator of abuse and neglect. It can cover all of those areas of maltreatment, if you will. And so I think if we really focus a lot on social isolation, I think we can help seniors to age in place safely. And especially when it comes to like sweetheart scams, I've seen a lot of that. I've heard clients talk about that, and they know that it's not real. But what they have said to me, I know it's not real, but it
Mhm.
feels good.
Yeah.
It feels good. It feels good to have someone to talk to. I'm embarrassed about it, but it feels good to have someone to talk to. Many of our clients, the only persons that come see them may be the provider, whether it's a person providing assistance with activities of daily living, a case manager making, quarterly or biannually visit. And so when, someone reaches out to them and expresses an interest and wants to listen to them, it makes them feel good. We all want to feel good. We all want to feel loved, no matter how old we are. So I believe social isolation is a key indicator um, for abuse, neglect, and financial exploitation, because that's what ends up happening.
Thank you for sharing that. I want to just switch topics briefly. It's really a tangential issue. I know that the AAA has a national family caregiver program. Can
Mhm.
you tell us a little bit about what that is?
Yeah, so I am so happy. Just recently, we hired a new National Family Caregiver Program Manager. And caregiving is actually one of probably the most unpaid helping professions, if you will. So the caregiver program is designed to really support caregivers who are caring for older adults or individuals with disabilities. The new care manager that we have in place right now is going throughout Montgomery County, throughout the senior centers, recreation centers, providing work groups and mental health series around caregiving. So there's a lot of outreach that's happening right now. We are partnering with nonprofit community partners. So we're doing a lot of work around the caregiving aspect of this work within the AAA. It is essential. And I have had the experience of being a caregiver, and I know what that's like. It's tough. Sometimes you feel like you're all alone, um, and you need that support. And so we're trying to find different ways and opportunities to make sure we reach the caregiving population.
Thank you for that. And I know with your
Mhm.
firsthand experience, you'll be able to continue to share more strategies that can be helpful and obviously contribute to that program. Now, does the AAA have any upcoming events during the month of June?
Well, yes, I happen to be the co-chair for World Elder Abuse Awareness Day with Mario Wawrzusin, and I have been in that capacity probably for the past 4 years or so. And so that event is on June 11th. So we are in the planning stages of that right now, really to continue to raise awareness of abuse and neglect.
Mhm.
And we also are adding into that theme Longevity Ready Maryland.
Does the AAA have a newsletter?
Yeah, so the AAA does have a newsletter. We have the senior news, which is disseminated monthly, and also back to the caregiver program. The caregiver program has a newsletter that comes out monthly as well with resources and information. So we do have newsletter. I'm also the editor-in-chief, if you will, of the Aging and Disability monthly newsletter. So I am very involved. I know it's important to get the information out there. So we are growing, steadily growing in that area.
Well, thank you so much, and we look forward to having you back on at another time.
Thank you for having me.
Absolutely. Well, that concludes our program for today. As you can see, the voices of those 50 plus matter every day and in every way. To learn more about services for seniors in Montgomery County, please visit the Montgomery County Seniors website by visiting montgomerycountymd.gov/senior or call the Senior Resource Line 240-777-3000. And as always, thank you for watching 50 Plus in Montgomery County.